All right. Good afternoon, everyone. It's afternoon. Yep. And it's finally started raining over here. So I am very happy about that because I hate driving, walking, or looking at the rain. I like to sleep in it, but I don't want to look at it during the day because it makes me sleepy. So, as you probably know, I am Dr. Campbell, and I am here to finish up your CMAA training. And so for our very first session, and I'm sorry, I put this lotion on, this Avon lotion, and I've been rubbing my hands for about 5 minutes trying to get it in, but I love it because it's great. Anyway, what I want to do, because I don't know all of you, I would like to have you tell me your name and a little bit about you. And I have a notebook so that I can take a few notes because I may forget your names after you say it. So it's easier if I have some notes to refer back to. So whoever wants to go first can go first.
All right, I'll go first. Wait, yeah. So my name is Jeremy Harrison. I actually work at Candy King College as a lab technician slash tutor kind of thing. And I've been there for a number of years. And I think I got the information for the CMAA training while I was there. And I've always wanted to go into the medical field and stuff like that. So that's the reason why I'm taking the course.
All right, thank you so much.
All right.
Good afternoon. My name is Jocelyn Jenkins. I am a boy mom. I currently work part-time as a home health aide and just looking to kind of finish the course so that I can, I want to do registration inside the hospital. So I've been trying to get in the hospital doing that. So I believe this course will help me get to that point in my life.
All right. Next.
Hi, my name is Angela Henderson. I'm a mother of 5, grandmother of 4, and I took this course to get back into the work field.
All right, thank you. I'm writing and looking at the same time, so if you see my head moving up and down, I'm so happy y'all turned all cameras on. That is just awesome.
Well, I'm Larita Edwards. I'm a mother of 3, grandmother of 1, auntie and great auntie to a plethora. Took this course because I've always wanted to be in registration. Tried it a few millennia ago and, never got in. And this was a way for me to refresh what I had learned, but also another chance to go back into a field that I was very passionate about.
All right, thank you.
Hi, I'm Erica Smith. I work at Stroger Hospital. I was looking at your credentials. You have quite a bit of credentials that I have. And I took this course because I needed something to do with the rest of my time. So learning is always important to me.
And you at work right now? I'm trying to figure out. You at work and you in this class? I'm confused.
Yes, I work. I'm a RHIA as well.
And you work at night or you work during the day?
I work during the day.
Oh, you on lunch or something?
No, I work from 4:30 to 12:30.
4:30. Okay, I'm just making sure you're not violating no.
No, I told my boss I have to
pay our money,
and then I pick it up afterwards.
And
they're understanding.
Okay, and so you work. So you're not gonna be sleepy during this time, are you?
No, I try to keep my coffee and do what I need to do.
Got it. And what do you do at Stroger?
I'm a medical records supervisor.
Okay.
for Providence and Cook County and the Cook County clinics.
All right. Thank you.
Thank you.
One, two. Two more people left. Somebody
I'll
just
go ahead and go. My name is Sheila Jones. I guess I have experience or my most recent work experience was as a psychiatric rehabilitation service coordinator. So that was a nursing home case manager for people with mental illness. I just wanted to, I guess, expand my skill set and learn something else. That's why I took the course.
All right, thank you. Smiley.
Hello, my name is Verla Houston. I work over at NextSec School. I work as a paraprofessional in the classroom. The reason why I ended up taking this course is because I wanted to go basically where my degree is in administration. So hopefully I can be able to utilize this course and geared towards more in the medical field, but also in administration.
So you working with the little people?
Yes.
Woo. That sounds like a lot of fun.
It really is.
We're gonna take your word for it. I'm not gonna ever. You should never say never, but I'm not gonna ever try to do that. All right. So I mentioned I am Dr. Campbell, and I'll tell you a little bit about my background. So I've been in healthcare since 1992. And I started off as a medical assistant working in the physician's office and pretty much did everything from the front office to the middle of the office to the back office. And while working as a medical assistant, I realized that I didn't like working with patients, but I did enjoy healthcare. And I also realized that there were certain aspects of healthcare that I liked. Number one, I did not want to be, and 1 second, somebody's coming back in. I did not want to be in a position where I was directly working with patients, but indirectly. So after working as a medical assistant for 5 years, 5 years into my healthcare career, I earned a bachelor's degree in healthcare administration. And I did that primarily because I wanted to be in charge. I felt like my boss didn't know what she was doing. And the only thing that was standing between her and I was something that commonly happens to minority individuals. So I decided to get a degree and in healthcare administration. And so in case you didn't pick that up, the only thing that was standing between me and that person was color, was race. So, but they didn't have a degree. So I realized as a minority, I needed to get a degree. And so I did. So in 97, that was the last time that I worked directly with patients, because again, I don't like patient care. I come from a family of nurses. I didn't want to ever be a nurse. I got into healthcare because I had a baby and I needed to put food on my table. So in 1997, I transitioned out of medical assisting and went more into management. And then also at the same time, I started teaching medical assistant. Back then they had different names: medical office assistant, medical administrative assistant, and medical assistant. I also taught medical transcriptionists. Those are the people who are typing up notes. You don't see as many of those individuals anymore. And then also I taught medical billing and coding, because while I was in the office, I basically learned everything front, back, and middle to the office. So from there, I ventured into a director role at Stroger Hospital. So I worked at Stroger probably for about 3 years, and I was the administrator for the Division of General Medicine. And there's a couple of reasons I left. One, there was a snowstorm and it took me about 5 hours to get home. That was like a nightmare. And then two, I tried to get a higher position. Once I started working at Stroger, I was already in school to earn a master's degree in healthcare administration. So my goal was to start at Cook County and grow into a higher role. Well, I was in a position that was a grade 20, and the next position beyond that, or two positions beyond that, apparently you had to be political to get that job. And so I applied for a job and at one of the other hospitals, I think it was Provident, and I did not get the hospital. And so it was two things I realized. Number one, I don't like being told no. I'm okay with not right now, but not no. And so once I left Cook County, I decided that I would be a greater benefit to the healthcare industry if I owned my own business. So in 2002, I started the company Physician Practice Resources, and we provide a variety of services for physicians and hospitals. So medical coding, anything that's you can do in the physician office, we provide assistance to hospitals and physician groups, primarily physician groups, but occasionally some hospitals. So I've been doing that since then, as well as teaching. And I generally teach for universities. So I've taught at Kennedy King. I currently teach for a few universities online. And from time to time, I come and hang out with Metropolitan Family Services and teach this class maybe a couple of times per year. So I am based in Midlothian, Illinois. So I'm actually in my office right now, so I can see the sun and no rain. And I'm very happy about that because I had to have several cups of caffeine this morning to kind of fight the rain. So that's enough about me. And I'm sure I will learn more about all of you and more than what you've shared thus far. So my job is to cover 6 of the 7 domains that you are going to see on the CMAA exam. One of the things that I will tell you that I think is very important as you prepare for this exam is that you really start to think about what this person, the certified medical administrative assistant, does on a day-to-day basis, who they work with, what tools they use to do their job. Because when you take the exam and you see the questions on the screen, you need to be able to have a visual in your mind, a mental picture in your mind of what that process looks like and how you would answer the question. So there are 7 domains. The first one is called scheduling. So that's what we're going to be talking about today. And then after scheduling, our next topic is called patient intake. So scheduling, we got to schedule the patient for the appointment. And then intake is when the patient actually shows up for the visit and what happens after that. The third domain is called office logistics, and that's literally about how the office operates. I had never heard of the word logistics. It's an English word, but I had never heard of it. I don't remember hearing it in high school, but I have a friend, one of my really close friends from high school. she got a bachelor's degree in logistics. And so one day I asked her, what do you do at work? And so she's been at her job forever. And what she does, and I'll just use her example to show you how it relates to the medical setting, but she works for, I don't know what their name is today, but the Quaker Oats people, you know, the oatmeal people, they got Pepsi and a bunch of other products. So her job involves making sure that there's enough product that can be sent to all the different stores. So you can imagine what her life was like during the pandemic, because there was, you know, the trucks not doing what they were normally doing, stuff wasn't being produced. And so she was really stressed out. What's this, May? I'm not gonna say a year ago, but maybe around June or July, just trying to figure out how to make sure that all the different stores have products on the shelves. And then she's also involved in when they have new products, looking at how that's selling. So she told me recently they have Flamin' Hot's macaroni and cheese, which I think that sounds gross. And I don't eat spicy food, but apparently it's a hot product and people are buying it. So I guess they were bored during the pandemic. So they made all of these different variations of mac and cheese. And so part of her job is to stay on top of where that product is selling. So like Walmart, or she also has, you know, grocery store chains all over the country. And so figuring out which ones order more, which ones order less, which ones do they need to pull it from that store altogether, working all of that out. So in the medical setting, logistics is about how we operate, right? And how we carry out the day-to-day duties to support the providers as well as be a resource for our patients. So that's office logistics. The fourth domain is called compliance. And if you don't know this, healthcare is a highly regulated industry. And we got lots of rules and regulations that have to be followed. And one thing I want you to know, especially for those of you who, let me get y'all names. See, Miss Jenkins. That's the only last name I wrote down. I got y'all names written somewhere else. But I'm just gonna call what y'all do. The RHIA, the home health aide, the psych rehab coordinator, all of you who have worked in healthcare before, you have to know today, this test is not about what you do at your job, because number one, what you do at your job may just be what they do at your job and not necessarily the right way to do things. Sometimes government operates a little differently than the private sector. So the information that we're going to cover, this is how they expect you to answer the questions. So don't think of them as how you do them at your job, because you may be taking yourself down the wrong path. So compliance has many areas, and we're just really gonna just briefly touch on compliance, not as deep as we can get. So that is the fourth area. And then the fifth area is patient education. And there we're gonna talk about how we communicate with patients and what rights our patients have and how we have to protect their information. And then the sixth area is general policies and procedures. And I mentioned that you got to answer these questions on this test based on how we're going to discuss these concepts. And I will be very intentional about telling you, this is what you need to know for the test. But because the real world isn't the test, I'm also going to give you the perspective of what I see on a day-to-day basis. And some of that has changed, post-COVID. Things look a little different, and some things look the same, some things got worse. So let me make sure I gave you these names. So scheduling was the first. The second is patient intake. The third, office logistics. The fourth, compliance. Fifth, patient education. Six, office policies and procedures. And don't forget, I am recording this. So when I post the recording, I will later today let you know where the recording is, and it will be there every day. So if you miss class for some reason, you'll be able to go and grab the recording. Now, that does not mean that you should just not come back and miss class, because Mr. Pugh gonna keep it 100 with you. I'm sure he has said that at some point in this class, because I think that's one of his favorite words. He gonna be looking for you if you don't show up. So anyway, number 6 is office policies and procedures. And then number 7, I'm not going to cover in terms of introducing you to, because you've already been introduced to it, which is medical terminology. And if I were you, if you made flashcards or whatever, you want to make sure that you have, that you continue to review them, because you know that old saying, if you don't use it, you lose it. That definitely will happen after we talk about these topics. So our journey together is going to be where I'm going to introduce the 6 topics that I'm responsible for. You will also have exams related to these particular, they're called domains. And not today, tomorrow, we will talk about exactly what they are expecting you to know at a minimum. And again, you need to be able to visualize these concepts and apply what we're covering on a multiple choice test. But again, the real world is not multiple choice. And you will hear me make reference to, yeah, we don't do that anymore, or in your role, you would not see that. I've actually said to NHA that I felt like they needed to update this exam to be more reflective of what's happening today. And you will see exactly what I mean when we get into the scheduling part, because you'll be like, what? Why do I gotta know this? And I'm just gonna tell you, you probably don't need to know it, but for real world, but you do need to know it for the exam. And there was something else I wanted to tell you. Oh, I'm sure that you started to look for jobs, and don't type in CMAA as a job. You need to type in patient access. That's the new term for patient registration. So, because you're not going to necessarily see CMAA listed. So what you want to do, I would encourage you to look for jobs. And as you're learning different concepts, you see a job ad and you're like, oh, we learned that. I know how to do that. A lot of job ads will say they want you to have experience, and I would just ignore that, because you send first of all, if you got a good resume, you send your resume in and they call you in for an interview, that's when you get to close the deal, right? You need to go in and let them know that, don't even talk about the fact that you don't have experience. Get in there and take over the interview and show them that this person is somebody that's motivated, they can actually do the job, as opposed to somebody who we got to get pom-poms out for every day and get them pumped up for being at work. Somebody who they're like, yeah, I could see that person really fitting into their culture. And this is the reality. Not every culture, as it relates to the organization, I'm not talking about race. But not every culture is for everybody. So for example, I mentioned myself at Cook County Hospital Stroger. That culture wasn't the right culture for me because I am a person that likes to grow. And when I was there, I felt like there were a lot of people who were there. They were stuck there because you got good benefits, you get all them holidays off, good or bad, your pay goes up. A lot of the people who work at county are in the union. And I know this because I know people who work there today, and I used to supervise people who were in the union. And when I would try to get them to learn something new, and back then it was like Microsoft Word and Excel and PowerPoint to try to take their skills to the next level, because what you don't want to have happen to you is an organization comes to you and says, your services are no longer needed. You need to say, thank you very much for the opportunity and move on to your next thing, but be ready to move. And so I felt like that culture wasn't for me because I am the type of person that likes to, I like to keep moving. I like to keep growing because my motto is, are you going or will you be left behind? And I don't want to be left behind. And I think a lot of times the person who stands in our way the most is us. We allow us to stay where we are. So anyway, back to these 6 areas. Now, just because I'm not going to cover medical terminology does not mean that I may not add some questions into my questions that are medical terminology related, because I know some of you, you're going to say, well, I did pretty good on the terminology. I know terminology, so I really don't need to flash through my flashcards or look through my notes. And then we fast forward to 3 weeks from now, and you're like, I do not remember those words, because it is truly something that if you don't use, you lose it. So when we talk about scheduling, this is really what I like to refer to as the beginning of the healthcare revenue cycle. Whether you want to accept it or not, healthcare is a business. And you may be thinking, whoa, I thought they're supposed to just take care of the patients. Yes, that is true. But just like any business, they got bills to pay. For example, in this space that I'm in right now, I got rent that I have to pay every month. In order for me to talk to you on this computer, I got to pay Comcast, right? In order for me to be able to work, I need lights. If I don't want no little ants around, I got to vacuum my floor and take the trash out, right? Now, this is a small office, so I don't got no custodian. I got to go around and pick up my own trash. So hospitals, medical groups, they got bills that they got to pay. And their biggest bill, any organization's largest bill, is always going to be payroll, because you got to pay your people. If you don't pay your people, you don't have anybody coming to work to do the work. And unfortunately, there are hospitals and clinics today that are barely keeping their doors open. And this is something that I think that we saw during the pandemic. We saw these companies closing that was kind of big. We thought they were big, but this is the reality. Just like we all live paycheck to paycheck, a lot of those businesses was living paycheck to paycheck as well, and they couldn't keep their doors open. So healthcare has people. And then I don't know about you, but when I go to the hospital, I like for it to be clean, look clean, smell clean, running water, hot water, not cold water, tissue, all of those things that make me feel like a patient that wants to be in that organization. But they got to pay for all of that stuff. And some organizations are barely keeping the doors open. So scheduling is that first encounter that we have with the patient. And the scheduling process is what puts the patient in a slot for a service. Now, how many of you go to, you have somebody that, I was gonna say combs your hair, but that curls your hair or washes your hair, you know, a hairstylist. How many of you have, you got a hairstylist? You do your own hair? Okay, some people got a hairstylist. All right, so when you see the hairstylist, you gotta make an appointment, right? You can't just walk in. So some hairstylists have moved to a model where you gotta make a deposit for your appointment because, you know, people, they don't respect other people's time and they make an appointment and then they don't show up and there's somebody else that could have been in that seat. Funny thing, I'm noticing that, you know, restaurants where you sit down and eat, I probably the last 2 months. So first, let me tell you about me. I don't really like going out in crowds because it makes me uncomfortable. So you will hardly ever see me in a mall or in a place with a lot of people other than the airport, which that makes me nervous too. But I like to make a reservation so that if I want to eat dinner at 5 o'clock, my name gonna be on the paper and I can go in. I saw on Friday night is date night. And I probably should have mentioned that too. I got a husband, 4 kids, 22 through 29. We do not have no grandkids. We do not want no grandkids right now. We just want to just roll for the next 5 or so years with just being us. And then we can get some grandkids. So anyway, Friday night is date night. And I went online to make a reservation. This one restaurant wanted a $25 deposit per person. Well, who said I was gonna eat $25 worth of food? A cup of soup costs $4. So why I gotta give you $25? So they started this policy because they got limited seating and people would make reservations and they wouldn't show up. And so they are requiring a deposit. Well, you're going to find that because of patients doing us wrong, we've had to have a similar structure to force patients to respect our time, because every patient that we see results in payment for services. And those services that we're receiving reimbursement for is to pay all of us. So if we got people in slots and they don't show up, that's a slot that somebody else could have had. And if you think about, I don't know if any of you did this back in the day, but back in the day, my parents did not have health insurance and we had to go to the Fantis Clinic. And that's at the Cook County Hospital. I don't know if they still got the Fantis Clinic, but Fantis Clinic gave us an appointment and we waited there for a long, long time. And they gave everybody the same appointment. And so we all figured out we need to get there early, get some food off the food truck, and then or bring a peanut butter and jelly sandwich and just sit there and wait. But they had that model because they got all of these people that they got to see, and some people not going to show up. And, you know, people are disrespectful. People don't respect people's time. And so people would not show up. So they had this model where you got a 7 o'clock and you got a 7 o'clock and you got a 7 o'clock, and we're going to see you in the order that you arrived in. But it's still going to be a breakfast, lunch, and dinner event, depending on what day you went. But they have a large supply of patients, but not, a lot of demand, but they don't have enough providers to see all of those patients. So every slot is valuable, and we have to make sure that we are getting paid for those services so that we can get paid. So when we talk about scheduling, you may be thinking, well, I've been to the doctor, so I know how I schedule my appointments. I call in on the phone, or they got this computer way, you can log in to your patient portal and schedule appointments. I like that process and I don't like the process. I don't like it because that takes somebody's job. So usually I call in on the phone and make my appointment so that the people who are answering the phone, the organization can see that they can keep their job. The other reason is when I look in the system to try to find who I got to see, the list is so long and I'm just scrolling and I'm like, wait a minute, I'm the patient. I'm doing somebody else's job trying to get my appointment scheduled. So as a patient, you've seen all of this stuff on the other side of the desk, but I want you to be on the other side of the desk from now on. You're the person that's actually scheduling the patient. So on NHA's test, they want you to know that there's two types of scheduling system. Now, the first one, some of y'all that's a little younger, y'all like book scheduling. Yeah, a book, a physical book where we write in the person's name, and of course, we're gonna use a pencil, because if we use a pen, it's, you might have to use whiteout. Some of y'all like, what's a whiteout? Might have to use whiteout to white out that slot, put somebody else's name in. So usually with book scheduling, it is a physical book. Now, some places still use a book today. There are some problems with using a book. Number one, the book can come up missing. And if you don't have the book, you don't know who's scheduled for an appointment or not. Also, I don't know about you, but ever since I learned how to write in kindergarten on that paper with the lines where they taught you how to write in the lines, I still write that big today. So if I'm writing in the appointment book, I'm gonna take up a lot of room. And I like to write in blue ink instead of black ink. So I got blue pens everywhere. And so there are many, 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 many disadvantages to the paper system. First of all, if you're using a pencil and you got to erase to move somebody around, or if you even got to find somebody call in, want to know when their appointment is, and you like, well, do you know around when it was? No. So now you in this book like, okay, let me find the appointment. But there are some advantages to the paper system because it's cheaper, right? You can just go to Woolworth, Walmart, Target, Office Max, or whatever, and you can get you an appointment book, and you can have the little dates in it and all of that. So you may be thinking, they want us to know that? Yeah. And they honestly want you to know the advantages of the book versus the computer. So there's the computer. So this is a screen of what the computerized schedule looks like. And not today, on a different day, I will show you a few more examples. But when we talk about the computer scheduling process, we are really talking about an electronic system that is going to capture the patient appointments by provider, by clinic. So for example, here is a electronic schedule. And what you will notice under June 5th, which is going to be on the left-hand side, you see the first patient, Gregory Porter, who's scheduled for 30 minutes. You see it's an office visit. You see their phone number. That's there in case we need to call them to cancel. We can also, remind them about their appointment, all of that. And then underneath there, you see another patient still under June 5th for Sylvester cop, that person's appointment is only 15 minutes. Then next patient, Jack Paxson, another 15-minute appointment. Then at 9 o'clock, you got a new patient, Georgia Shannon, and that appointment is for an hour. And you see the list continues from day to day to day. You should notice some of these patients are scheduled for an hour, some are scheduled for 30 minutes, some are scheduled for 15 minutes. It really just depends on the provider's preferences and the organization's policies and procedures. So some offices will say new patients, they get an hour. Some facilities will say new patients, 30 minutes. Typically, established patients, 15 minutes, because we already know the patient. They're just coming in to follow up on the problems. Usually it goes fairly smoothly, except the patients coming in, they want to talk about 10 different problems and we only got 15 minutes and we got to get to the next patient. Sometimes the doctors will say, all right, what 3 problems you want us to focus on today? We're going to focus on those 3 problems and you can keep going. I have parents that are in their 70s. I'm 25 though. I have parents that are in their 70s, and my dad, it never fails. The doctor is about to leave out of the room, and my dad is like, yeah, one more thing. And I be like, Daddy, he got to go. Next time, you're going to get your list together in the car. That's what I told him. In the car, we're going to, everything you want to talk about, and then we're going to go one at a time. And then when he get up to go to that door, you can't stop him. Sometimes the visits it work and sometimes it don't. But anyway, the doctor is very nice and patient, so he lets him ask yet another question. I told my daddy he need to get a girlfriend or something because he needs somebody to talk to because he always bothering the doctor. All right, so the other thing that you should notice is June 7th, there's nothing there. So that means that that time is blocked off for some reason or another. It could be that the doctor is off that day. It could be that the office doesn't open till 9. When we set up our book schedule or the computer schedule, we have to block off those times that we're not in the office or it's unavailable. So for example, on my own personal calendar, I have 12 to 1 blocked off every day. Now, what you think that's for? Well, I can eat my lunch, right? I have 8 to 9 blocked off. Why? Because I want to drink my caffeine by myself, play my music, get my mind right so I can execute my day. Also, for the next 3 weeks, 12:30 to 2:30, I got that blocked off on my schedule. Why? Because I'm gonna be here with you. So when we have an electronic scheduling system or a paper system, it is very important that we block off the times that we are not available. I even have on my calendar, what is it called? Mental break. So scattered throughout the week, I got 15-minute little mental breaks scheduled because I have a system that people can schedule an appointment with me. And sometimes I just want to, do basic stuff. Sit and look at the wall for 5 minutes, go to the bathroom, basic stuff. Call my mama, see how she doing. So in the hospital, in the doctor's office setting, they set up the times that we're not going to be available. Some offices will say 12 o'clock, 1 o'clock, that no patients can be scheduled because we want to allow staff time to go to lunch. And so usually what happens is that last appointment might be 10 or 11:30. So we can then try to finish up our patients and then everybody can go to lunch. We'll turn the phones off so that we can just, lunch, bathroom, people got to take a smoke break, people got to call their kids school because their kid was bad or whatever. People got stuff to do. So we block off so that we can have that time uninterrupted. Our doctors, they may have conferences that they have to speak at. They may have, they got to go to the hospital and see patients. They might be on vacation. All of that has to be blocked off. Now, when we talk about paper versus book, it is very easy in the electronic system to pick up an appointment and drag it over to somewhere else. But in the paper book, first of all, we got to see where we're going to move that appointment to. Then we got to write it in over here and erase it over there and then block that off. And then when patients call in for appointments in the electronic system, the system will tell us what is available. In a paper system, what we got to do? Flip through the pages. First of all, we got to ask the person, what time works best for you? And then they like, 2:00. Oh, no. I got to pick my daughter up from school at 2:00. That's not going to work. Okay, let's try 9:00 on this day. Okay, yeah, that sounds good. Oh, you know what? I got to go somewhere else on that day. So we spend a lot of time flipping through a book, whereas in the computer, you just let the person talk and you say, okay, I got a 5:30 on this day. I got a 10:00 on that day. And I hate to say this, but usually when I'm calling the doctor, I have to sit down and write out 5 times when I'm available. So when I call in, I don't be the person on the other end saying, no. I just say, hey, this is one of the days I'm available. Can you look that up? Or what's the first day? So then I don't look like crazy. And I look at my list and say, okay, what about this time? And then I get it done. But a lot of patients, when they call us, sometimes they're a little confused. And so we have to be patient and figure out where we're going to put them in. Now, if you look at this particular schedule here in the computerized system, it's very clear that it looks like we got an appointment available on June 5th at 10:15. And then it looks like on June 6th, we got something available at around 11. And then June 7th, from 8 to 12, you don't see anything that's available. Then Thursday, looks like we got something available at 11. And then Friday, we got something available early. So usually what happens when we get the patient on the phone, we'll say, do you need morning, afternoon, or evening as a place to start? Now, in this system, in the computerized system, you may be looking at a schedule by day, or you may be looking at a schedule by provider. In some clinics, providers rotate in and out. So for example, I have asthma and my lung specialist shares office space with 2 other doctors. So when they set up all 3 of their schedules, one of them is like this day in the morning from 8 to 11. And then the other day, maybe they're in the afternoon, and then 2 days in between, they're off. So they're working that schedule so that they can share that office space. But what they also share is us. They come in and out. We just come in every day and help support them in their day-to-day tasks. So more about the schedule later. But now we got to talk about some boring, you will probably never, ever, ever hear these words again, which are the types of booking or types of scheduling. So yes, my friends, you do need to know this information. On the CMAA exam, they want you to be familiar with what are known as the types of booking or the types of scheduling. So the first type is called wave booking. And if you ever went downtown at Lake Michigan, the water is in waves, right? And when it's real windy, it's kind of heavier. So with wave booking, instead of the patient's schedule being scheduled like every 20 minutes, they are scheduled at the same time each hour. So this is what I felt like County used to do at the Fannis Clinic. Everybody come at 9 o'clock. So you 9 o'clock, right? And then we all figured out, why is all these people here at 9 o'clock? We all got the same time. So then we leave home earlier and get there at 8 o'clock, but we didn't realize they told some other people to come at 8 o'clock. But wave booking is designed to create flexibility in each hour. Because number one, somebody's gonna be late. A lot of people gonna be late. Let's just face it. Because once you figure out that everybody got the same appointment time, some people are gonna be early. Your people who are just late people, they're gonna be late. So the objective is, if all of this group of people has a 9 o'clock slot, we get all of those people in. And then when the next wave comes in at 10 o'clock, we're done with the first wave. Now, how many of you guys know when 10 o'clock came, they was not done with them 9 o'clock folks? Probably wasn't done with the 8 o'clock folks, which is why that backlog of people sitting in chairs angry is what the end result is. So that's what wave is. So think of, every hour you got a wave of patients coming in. I also remember wave back in the day, Gately Stadium at the football games when our team was playing, and we would do the wave, right? So everybody would go from one row to the next and we would wave. So patients are coming in waves. Is Gately Stadium still open? I don't got no grandkids or no little kids, so I don't know. All right. Modified wave. So modified wave is where 2 patients come at 9, 1 patient comes at 9:30. So it's still in waves, but it's slightly modified. So for purposes of the CMAA exam, what's going to happen is that they will ask you a question or give you a scenario and expect you to identify what type of booking this patient has. Double booking, bad business. Double booking, and this is very important to know. With double booking, you got 2 people coming at the same time for the same person. So same time for the same provider. Now, this is what I think some of the hairstylists do. They double book. And so everybody's sitting all on top of each other waiting to be seen. So double booking is not something that's done often. We usually will maybe have to work some patients into the schedule. Like, for example, let's say somebody's sick and we don't want them to go to the emergency room because it's a problem that we can solve in the office, so we work them in. Or we have a patient that was admitted to the hospital and they need to come in for a follow-up. We may work them in. Now, before we work them in, we got to look at the schedule and see where we can work them in. Because if this the appointment right at the same time as my daddy, that's probably not gonna work because he gonna, ask all these questions at the end while the doctor at the door. But maybe you see, oh, we got somebody scheduled at 9:15 to come and get a COVID vaccine. That's quick, right? Or a flu vaccine or hepatitis B vaccine. That's an in and out appointment. So we'll slide them in. We would not slide, we don't generally double book a patient on top of somebody that is already a complex patient. Okay, my favorite, option 4, stream time specific scheduling. That's when there is a slot with my name on it and nobody else is in that slot. That is the way that, not at county, but in other clinic settings where patients are prescribed or not prescribed, are scheduled for a specific time. That time slot belongs to them. Open booking. Open booking, I don't know where they got that name from, but I'm gonna use a name that you might know. This is like the emergency room. This is like the walk-in clinic. You don't need an appointment. You just come on in. As long as we tell you we're taking walk-ins. So here, open booking, first come, first serve, usually seen urinary tract infections, sexually transmitted disease, upper respiratory infection. This is usually what you see in the open walk-up clinic type of situation. And then lastly, we have the cluster or categorization booking. Categorization is just a fancy word for booking patients by categories. So for example, my OBGYN, they see patients for ultrasounds on certain days. And on that schedule, all you have are ultrasound patients. They're grouped together based on the ultrasound. Now, part of that is because the ultrasound person is not there every day. My OBGYN, they schedule special procedures on certain days. So for example, if you have a pap smear, woman has a pap smear, comes back positive, and they want to do tests to, open up the hood and look at the transmission and all of that, that's on a certain day and time because they got to have special equipment to do that. School physicals. We'll group together the school physicals. Why? We got to fill out those forms. We got to have the vaccines lined up. We're probably going to need extra people to hold the kids down. And so we book them together based on the category. Let me see what else. Well, that's enough examples. But you get the picture. It's grouped together by a category as opposed to sick visit, non-sick visit, sick visit, non-sick visit. Oh, a category could be sick visits. So they may say this afternoon from 2 to 5, anybody that's got the cooties, they can come in and we can see them. First of all, I don't know about you. This is before COVID. Don't think about COVID. Before COVID, I don't want to be sitting in the doctor's office with somebody who is like, right? You don't want to be nowhere near that person. So we group all the sick patients together because they sick anyway, and they can just come, we can take care of them and get them out. So those are the 6 types of booking. Questions on what we've covered so far? Now I got a cough because I said that. And if you are typing in the chat box, just FYI, I'm not necessarily in the chat box that often because, you know, you can see me, I can see you. You can just turn on your microphone. I jinxed myself. Okay, so no questions. Let's take a 5-minute bathroom break because I got to go to the bathroom. I'm sure some of y'all got to go. So 5-minute bathroom break. I'm going to pause the recording because we don't need the bathroom break in the recording. Minutes. So we are going to get started again. So everybody's good with those types of booking. You will see them again, not to worry. All right, so we looked at this schedule already. So what would you say are the advantages of the computerized system over the paper system?
Immediately with the computerized versus the paper system. It prevents, I guess, double booking because you can see those slots.
Okay, your sound was low. You finally
Oh,
got
sorry. Were you able to hear me?
Yes.
Okay. I was saying that you can see all the available appointments in one place with the electronic system. And it also, I guess, can limit or reduce double booking because you can, I don't think, it doesn't look like you can put 2 names in one spot.
You can put them like side by side in the slot. But on here, there is no double booking in this example. But yes, you can do that. As long as one thing you want to understand about the computer system is in the background, we have the ability to turn certain things on and off. And so they could essentially turn off the ability to double book, then you can't. All right, so what about that paper book? It's cost prohibitive, right? Well, no, not it's cost effective. Not it can be prohibitive if you lose it and you got to buy another one, and now you done lost all your people's appointments and people are just showing up. Because the other thing about the schedule that you need to know is we start to know our patients, know what our patients' needs are. And so if you got a certain patient, and I'll use a perfect example. My 29-year-old daughter is special needs. She does not talk. She cannot hear. Even though she's physically 29, she's mentally maybe 4, 5. And so when she goes to her appointments, when they see her name on the schedule, they know, how that visit is about to go. So you have to consider your patient's needs as well as the needs of the organization, because the two actually go hand in hand. So like, for example, my daughter, 29, she's about 105 pounds, but she is super, 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 super strong. So if she's going to have, like, for example, when she got that COVID test, boy, she had to have 2 people hold her down, the one in the nose, because she wasn't going for that in her nose. So my husband, me, and another person had to hold her down so she can get that thing in her nose. And so when we learn our patients, we know what they need and what we need to do for them. So what about the book? What do you think some of the disadvantages of the book?
You maybe can write information in the wrong area within the book, not being focused.
Yes. And that we humans, right? So the phone ringing, you was writing somebody else's appointment in the book, you on the phone, you like, What's I writing in here? Oop, I hope this is what I was writing in here. You just write it and you move on, and then you realize we go to call this person to cancel, and we like, Mr. Jones? No, Mr. Jones live here because we done mixed up the phone numbers and all of that. But what else about that book?
Ooh, if you tear the page.
Wait a minute. What happens? Let me see if I got one right here. I don't got one right here. When you got a pencil and you erase the wrong way, you got a hole in the paper. All right, anything else disadvantage of the paper versus the book?
Maybe also just people's handwriting style might not be as legible.
Yeah, because some people, they didn't go to school to be doctors, but they write like doctors and you can't read nothing they wrote. All right, so you heard me mention the needs of different people. So we're going to talk about scheduling needs. When we talk about scheduling needs, and guys, 1 second, because I was cold earlier. I turned the heat up to about 85 and I'm hot. Okay, nobody's in here with me today, so I was cold, so I made it real hot. And did I turn the recording back on? Yep, okay, good. So when we talk about scheduling needs, there are 3 people we have to keep in mind: the patient, the provider, and the facility. Now, why is the facility important? And I gave you an example of my lung specialist and how they schedule the 3 doctors. Do you think that takes some thought process to make sure that Dr. A is where he's supposed to be on the schedule? Because what do you want to avoid?
Yeah, you want to avoid having a patient see the wrong doctor.
And people sitting on top of each other. And in my lung specialist office, they only have 3 rooms. So if you got 1 doctor, he's able to go from 1 room to the next. If you got 2 people there, maybe 1 doctor is in 1 room, 1 doctor is in the other room. So whose patient goes in the 3rd room? Is it a toss up? Is it that room is empty and you just work with these 2 rooms? So they have it worked out very smoothly where they have minimal overlap. So 1 is there from 8 to 11. The other one doesn't come in until 1, which allows that person to finish out their morning before the afternoon set of patients come. Okay, so patients, providers, and the facility. So when we talk about the patient's needs, patients have all different types of needs. I gave you the example of my daughter who is special needs. But then you also have patients who have visual challenges. You have, think about my parents. Both of my parents got them brand new shiny wheeled walkers with the seat on it. So you have to consider the needs of those people because they need to be able to get into the office, right? Manipulating with those walkers. They need to be able to get into the exam room. And so you got to consider that when you are just operating the office, no matter who's coming in there, even people who are working. You may have somebody that's in a wheelchair that needs to work. So outside of space, the other thing we got to consider is, would you want to have Granny coming at the same time as the little kids getting their vaccines? Why? Some of y'all got grandkids and y'all think it's cute. They cute because you can give them a bunch of sugar and send them back home.
Nope. 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 No. 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 I've been in that situation. No. Older patients ask a lot of questions. Lord, do they ask a lot of questions? And little kids ain't got no patience, none whatsoever, none.
I think both of those are very time consuming appointments. So there's just not enough time for that.
And the little kids are like little petri dishes because they sneeze on you and the next day, few hours later, you sick. My nephew, I was watching him. He was sitting right next to me. He sneezed on me. I kid you not. Hours later, I was sick. I had a cold because they got all kind of germs because they're in the building with all the other people, all the other kids. You don't know where the other kids have been, who they've been exposed to. So plus, we might need more staff in both cases, right? We might need more staff to help Granny manipulate with the walker because sometimes Granny, Grandpa comes with somebody and other times they come by themselves, right? So we may need to assist them getting on the exam bed. We got to assist them when they're making their appointments, leaving. They require a lot. And then I already told you with the kids, when they get in the vaccines, sometimes their parents can't hold them down. So we need an extra pair of hands to be able to, manhandle them and keep them down. Not manhandle, that's not the right term in the medical field, but you know what I mean. The other thing we got to consider, maybe we got young parents that work during the day and they can't come to appointments during the day because they got to take off of work. So we want to have some evening hours. Or what's the other option we do? Y'all been parents before. You can't go during the day, so you can go in the evening. And what's the other option they give us every now and then? Saturday, right? So
Weekends, yeah.
Yeah, we give them, and sometimes it's every other weekend, every weekend, it just depends on the organization. All right, so after the patient's needs, we have to consider our providers. So we already talked about blocking off the schedule to make sure, I really jinxed myself, all that shucking and jiving. We got to consider provider on vacation. So here is something that was really big during COVID. So I had an appointment scheduled with my lung specialist in December. And so the week before, the office staff called and said they were canceling all December appointments. And I was like, wait a minute now, I need to see the doctor because I was planning on going out of town. So I needed to get my good medication. So in case something happened, I had, my inhaler and all of that. And so I was able to see the nurse practitioner, but they scheduled all the appointments with the doctor. And generally, I don't want to see the nurse practitioner for my lung problems. I want to see the doctor. But at that point, it was whoever can give me a prescription, that's who I was going to see. So a few months later, I saw my lung specialist. I said, hey, how come you canceled my appointment in December? Because we got that, relationship. We talk about medical stuff. So he said, all of the lung specialists, and I should have known this and I didn't think about it, all of the lung specialists basically were living at the hospital in the month of December because they had so many patients that they had to care for with COVID, plus the normal, it was cold outside, respiratory problems. So in that case, can you imagine having a paper book and now you got to reschedule all these appointments? What you gonna do? You tear out this page, you take this one, somebody else take that one. So with the electronic book or electronic system, you can still print out a paper schedule and split it up amongst you. But it's a lot easier in the electronic system to move people around because you literally are just perhaps clicking on their name and hitting reschedule or hitting cancel. Providers have different responsibilities. Some providers don't see any patients at the hospital. So like my internal medicine doctor, he's like, I want to be at home with my wife at night. I don't see patients at the hospital. But then you got some doctors who are like, I don't really want to be in the office, so I'm just only going to see patients at the hospital. In either case, you have to know what your provider's preferences are, what their needs are. My OBGYN, 2 days a week, they're at the hospital doing surgery, right? They're either delivering babies or dropping transmissions. That's a hysterectomy, okay? So they doing one of those two things on those days, or taking out stuff or whatever. And so if they're at the hospital, they can't be at the clinic at the same time. Other things, and this may sound, I don't know, a little weird, but every provider has their little thing that they like, don't like. For example, some providers will say, I don't want my first patient until 9:30. Well, the office may open up at 9, or it may open up at 8. You got to block that provider's schedule off. Some providers will say, my kids got soccer games or whatever. I need to schedule my last patient for 3 o'clock or 2 o'clock so that I can be out of here by that particular time. You as the CMAA, you may not even be involved in this. When I look at this test, it reminds me of back in the day when the doctor's wife was the manager. That's what some of these concepts remind me of, but this is a means to an end. You just want to pass the test and move on. But some of the concepts are a little dated. Also, as it relates to providers, sometimes providers are guest speakers, different places. So sometimes they don't tell you in advance, and now you got to shuffle people around. You always want to know what your organization's policy is. Like, can they see somebody else in the practice? Do we need to schedule them? And when we think about our patients' needs, that's important to note, because what if one doctor couldn't see his patients today? You might have a patient who took off of work and they can't cancel that day off. So you want to consider your patients, because maybe you got to get them in on that date for that visit. When you have situations when the provider's schedule changes, like OBGYN, babies don't always come at a certain time. And so the OBGYN might have been scheduled to be in the office today, but somebody delivered early. And so they got to either leave the office early, come to the office late. We have to ensure that we are in tune to all of that. Something that's happening during COVID. One of my doctors that I see at Northwestern, she's an older doctor, and she basically said she wasn't coming on site. So every visit that she has is like this. I can see her, she can see me. If she needs me to get some tests done at the hospital, she fills out the paperwork in the computer system, and then I go to the hospital and have the services. But she is, in fact, I just booked another appointment with her for September. She's still not back in the office. She's still gonna do telemedicine, and she says she's probably gonna do that until next year. So that's her preference, and you gotta, gotta respect it. Other things to keep in mind: if you got construction going on, or if there's something where part of the office or building is going to be closed, you need to have that in the scheduling system so that that is blocked off. All right, enough about the needs of the people and the facility and the providers. So appointment protocols. When we talk about appointment protocols, this is where we really get into some policies and procedures. So number one, I told you, we got all kinds of patients. We got the late patients, we got the no-show patients, and every office has to have a policy in situations where patients are late, they're canceling, they're no-showing. So let's talk about late patients. Late patients, you got to be creative with them. Now, I don't know about you, but I'm gonna tell you about me. You got that friend who can't be on time to save their life. When I go somewhere with that person, if we supposed to be somewhere at 5, I'm gonna always tell them 4, because then they're gonna be there by 5. Patients that are chronically late, we will try to schedule them at the end of the day, because if we lock that door and they ain't come in, they ain't getting in. Patients who chronically no-show, put them at the end of the day. Again, we flip these lights off, we close them blinds. We may have 2 or 3 people in the back, but we flip that sign over that says closed. And the goal is to try to change that person's behavior. But if somebody is late, somebody no-shows and they cancel, we want to document that in our medical record system. Why? Patients who no-show, let's say they got all kind of health issues and they no-show for all of their appointments and then they die. What is the family gonna do when they die? Or they're gonna try to do?
They're gonna try to sue.
They're gonna try to sue. But if we have in our documentation that they no-show, that they are late, that they canceled, we have proof that we were here, they just didn't show up. When patients are chronically canceling, we have to document that, because sometimes we gotta fire patients. We have to, and when I say fire, I really do mean fire. We have to send them a certified letter in the mail saying that we're no longer going to see you. Because again, those patients oftentimes are trouble. They're not following the doctor's prescribed treatment plan, and then they get sicker, and then they want to blame us. No-shows, something else about no-shows. A lot of organizations are charging patients no-show fees. Why? Every patient that we see can result in a claim form being sent to the insurance company for payment of services rendered. So if this person is no-showing, and think about a heart specialist, and guys, hold on 1 second. All right, sorry about that. So think about a cardiologist. Anybody see a cardiologist? Anybody know you got a parent see a cardiologist? Okay, what you know about the cardiologist? If you call today to make an appointment, when is that appointment gonna be?
Maybe next month.
Yep, next month.
Maybe next month after the next month, right? So a lot of specialists, and there's a shortage of specialists, they'll have a no-show fee. So for example, my father had an appointment at the cardiologist. He didn't show up because he was in the hospital. They tried to charge him a $200 no-show fee. It's in their policy. If you don't show up for your appointment, you don't give adequate notice, that's another thing. Maybe you cancel, but you cancel the morning of. They charge a fee. Why? We can't put somebody in that slot 5-10 minutes later. So we need you to compensate us for our slot. Now, does everybody have that policy? No. But a lot of places are doing that because people are not showing up. Patients without appointments. Remember we talked about the open type of schedule? Those are the patients who would fall into that category. Now, most offices, you can't just show up and think you're going to be seen, but every office has some type of policy related to Monday afternoon, we're going to have this walk up, or it could be a certain time of the day, certain day of the week, but the protocols are how we handle these particular areas. Make sense? Head nod. Some of y'all need y'all caffeine. I had too much this morning, so I'm still pumped up. All right. How do we prevent no-shows? So I already talked about, documenting in the system, but in terms of preventing no-shows, there's a couple of things we can do. We can send automated text messages. We can have those phone calls that call you. Now, I don't know about you. I personally like the phone calls and the text messages because even though I have it on my calendar, the little annoying phone calls and text messages just keeps it top of mind, right? Appointment cards, only the old school, old school people, clinics, they have those appointment cards because people know people lose those cards all the time. You walk down the street and you see those cards, laying on the ground. Other things we can do, we can mail them a letter, mail them an appointment card reminder. Now, what's the bad thing about this mailed reminder? Is there a problem with that?
Especially right now, the mail takes, 3 weeks, 4 weeks to come.
Or never.
Yeah.
So, okay, there can be a delay, but think about this. Okay, what's this? It's a postage stamp, right? Some of y'all. Okay, so that's a postage stamp. Are these free?
No.
Okay, so if you mail somebody a reminder, you need a stamp. What else you need? An envelope or some type of card. You need ink to print onto the card. So today, you're not seeing as many places do those cards because it's a waste of money, right? So it's easier to get the cell phone, the text messages, any way you can think of to be able to communicate with the patient. When we schedule the patient for appointments, we ask them, how can we communicate with you? Text, email, phone call, whatever. And what we can say when we call you.
Dr. Campbell, I'm sorry. I have to hop off and then hop back on because when I signed up for this class, I have 2 children. They were doing remote learning, but they're doing hybrid. So I have to go pick them up from school. But I'm going to get back on my phone if that's okay.
That's fine.
Okay. Okay, so I'm just going to hop off and hop back on.
Okay. All right. So those are ways we can document no-shows. How many of you think those phone calls are annoying? Those phone calls and those text messages? Because sometimes they do call you 3 or 4 times. And have you noticed this new trend? Type Y for yes or C to confirm. And some places have even gone as far as you don't confirm, they cancel your appointment. And that's a way to change people's behaviors. Because if you don't, people make the appointment, they don't show up, and you will soon learn, not today, because today is almost over, that every visit counts. All right. So when we're scheduling tests and procedures. There's a process, and it's a pretty long process. And you may be thinking as a patient, wow, I didn't realize that this process was this long. So let's talk about what this process is. I want you to visualize you're at the doctor's office and the doctor says, I want you to have surgery. Or let's not do surgery. I want you to have some blood work or an MRI. So what happens, the doctor has to give you an order. Every service that the patient is going to have outside of that clinic, we have to have a written order that basically shows what they want done, to who they want it done to, why they want it done. So for example, if a person is going to get an MRI of the brain, they want to know why. Maybe the person is having these headaches. Depending on the insurance company, they may require that we get their permission first before we do the MRI or other tests. So MRI is pretty pricey type of test. And usually the insurance company will say, well, why you gotta do an MRI? How come you can't do an X-ray of the head first or a CT scan, something cheaper? It's like surgery. Well, do they really need surgery? Can't they just go to physical therapy and it'll get all better because it's cheaper? So if needed, we have to get the service pre-authorized. Usually what'll happen, they'll give us a pre-authorization number. That number will be our proof that we called in to ask for approval. Now, my husband says all the time, it's better to ask for forgiveness instead of approval. That is not how we operate in this world. If we don't get approval for services, chances are on the back end, they say, sorry, you didn't ask us for approval. We're not going to pay for this service. The other thing is, what if they don't pay for the service? Now who's going to cover the cost of the service? So when we're arranging tests, order, pre-authorization if needed. We need to get the patient's information because if we're scheduling them at a hospital, they're going to want to know that information. We need to know when the patient is available. Some tests, we can give the patient an order and they schedule it themselves. Other tests, we have to schedule it for the patient. So for example, patient's going to have surgery. Patient can't call up and schedule their own surgery. We have to schedule it because there's a lot of questions that the hospital is going to ask us. So we need to know when the patient is available. We also need to know if that facility is participating in that person's plan. So in a couple of weeks, you'll learn we got all different types of insurance plans. We got Medicare, we got Medicaid, we got the insurance for the military, we got patients got private insurance. And so not all facilities take all insurances. So we have to know upfront if that facility participates, because if not, we have to select another one. So for example, all right, so after we do all of this, we got to notify the patient. Hopefully, nothing has changed from what they told us before. So we notify the patient, we give them instructions, such as, who here has had a mammogram? Not me, because I'm only 25, but okay, you had a mammogram. So when you get a mammogram, they tell you not to wear what? Right? Deodorant and some other stuff. So I don't know because I'm 25, I just read it somewhere. So you have to give the patient the instructions. You got to make sure that the patient understands the instructions. How do you think is the best way to get the patient to confirm to you that they know and understand what you said.
Ask them to repeat it back.
Ask them to repeat it back. And that right there, that will tell you if they was paying attention, if they was watching General Hospital. That's still, come on, General Hospital, All My Children. My mama used to watch them. I don't know. I'm just 25. So, you know, making sure that they understand, because what you don't want is for them to show up for that test and then they can't have it. Like, no eating or drinking after midnight. And then they get there for the test. They done had a full meal. Now they can't have surgery. Why? Because when you have certain procedures, they put a tube in your mouth down the back of your throat. So if you got a full stomach, that's a problem, right? So depending on the test, you may have to get the patient to consent. And then after that, you write all that stuff in the medical record. Authorization number. If the insurance company gave you an authorization number, we want to put that in the record. We want to write down who we spoke to. Angela Henderson at extension 25167. It was Monday, May 10th at 2:18 p.m. Because if a month down the road, number one, you're not going to remember who you spoke to. And if somebody else in the office has to call to confirm or get clarification or whatever, we need that information in the record. And hopefully we have conveyed all of this to the patient and they're all good. All right, confirming future appointments. And don't forget, this session is recorded so you can play it 10 times. I will send you an email later tonight with the link to the recording. It's going to be the same link each and every time. Okay, so confirming future appointments. We must follow HIPAA guidelines. HIPAA, Health Insurance Portability Accountability Act. So when we're scheduling the appointment, number one, we got to use a low inside voice. We want to stick to the basics. We don't want to give so much information out over the phone that other people around us can hear. So for example, Mr. Pugh, did you want to come in and get your prostate test on tomorrow? First of all, what if somebody in the waiting room knows Mr. Pugh and now you done told all his business? Because maybe he wanted everybody to think he was 25 and now they hearing you talk about he got to get his prostate checked. Or talking about somebody's sexually transmitted disease. So we want to limit to the most basic information possible because we want to protect the patient's privacy. We're going to talk about HIPAA in maybe 2 days because HIPAA is more than just patient privacy. People just think it's patient privacy, but it's more than that. When we're on the phone, when we're going to be on the phone confirming patients' appointments, we have to make sure that we have permission to leave a voicemail. If we do not have permission to leave a voicemail, we should not be leaving a voicemail. So the patient may say, it's okay to call, but you can't leave a message. Or it's okay to leave a message, but you can only leave a message for certain things. Like, hello, Mr. Smith. We want to let you know that your gonorrhea test was positive. And we need to make sure that your partner or partners are medicated, blah, 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 blah. First of all, if the person has not given us permission to leave all of that information on the voicemail, we shouldn't, because not many people have the, push the buttons on the phone voicemail, but some people do. Also, for example, my husband knows my password to my phone, so he could easily, log in and listen to my voicemail. So I got nothing to hide, but if I did, I would tell my clinic, don't leave a message. Don't text me. I'll call you. I'll call you in a couple of days if I want to get my results back. So we have to know what patients want. Me, they can communicate with me any kind of way because half the time I'm busy. So I might need you to email me, Skype me, use 2 cone cups together and contact me. Do whatever you got to do to get in touch with me. But some patients don't want sensitive information on the phone. Now, that could also work with, when you got kids, kids, they be on your phone all in your business. You might not want your kids in your business. So every patient should be asked what we can and cannot give. So confirming the appointment, we are going to ask the patient some things over the phone, but you have to know that patients are not always forthcoming with information. So for example, when you call them on the phone, you're going to say, you're going to ask them about their insurance information. And has anybody ever gotten an insurance card in the mail that says you no longer have insurance? You got the card that shows you got insurance, but do you get another card to carry around that says, I don't have insurance? No, right? So patients give us the card, and if we don't check that they actually still have that insurance, we may give a service away for free. So when we are confirming their appointment, we're going to make sure everything that they need to know, we tell them. So for example, what our policies are, we got a, cancellation policy. If they need a referral. Anybody ever heard of an HMO plan? Health Maintenance Organization. So with an HMO, every patient is assigned a primary care physician. And if you want to go to see a specialist, you need a referral. So if you work for a specialist, and that person doesn't have a referral, one or two things gonna happen. They got to sit in the chairs and wait while we call for the referral. And are we going to get through right away? Maybe not. Or we got to cancel the patient's appointment. So when we're confirming, we have to say, do you have the referral? Because this is the thing. It is not better to ask for forgiveness. If this person's insurance says that they have to have a referral, we have to have that referral when they walk in the door. Because, and I'll give you one quick scenario. I used to work for a podiatry company, the Foot Doctor. And the Foot Doctor had offices, in Chicago, downtown Chicago. So one time I was at the office downtown Chicago. And if you've ever had a painful toenail or something that was painful on your foot, it hurts, right? So we had this patient that we brought them in, got their got their insurance card. We did not collect their co-payment, and we'll talk about co-payments tomorrow. We did not collect their co-payment. We got the insurance card. We did not get a copy of their photo ID. Patient said, oh, I left it in the car. I'll get it after the visit. So he go in the back, see the doctor. The doctor done cut off whatever was going on with his toenail and got rid of the pain. He was like, I'll be right back. He did not come back. His insurance card was just somebody's insurance card that was not effective, because on the card, if you look at, we'll look at some examples, Blue Cross Blue Shield, Aetna, it don't say it was expired. So he gave us the card, no ID. Now, I don't know why the person at the front desk did not get an ID, because in that situation, you have to say, I'm sorry, we're going to need to see a copy. We're going to need to see your ID before services are rendered. Because this is what people will do. I'm 25, you 25, I got insurance, you don't. So I give you my card. And if they don't ask you for an ID, you can go and get services under my insurance. People used to do it all the time back in the day. They shared a public aid card with other people. But what people didn't realize was whatever that person had, they don't got it under your card. You got it because you gave them your insurance card. So now we ask for the ID, front, back, insurance card, front and back, so that we can confirm that they really do have this insurance. And if they don't, cash is always king. And that man whose foot was hurting, he was vulnerable at that point. And had we done everything up front, we would have caught that he didn't have insurance. We would have asked for a debit card, cash, or something to pay for the visit. Now we've given away free services, and everything he gave us when he registered was bogus. So we tried to send him a statement. None of that worked. So now we just gave away free service. And every service the doctor provides. And I want you to think about this like when you go to work. You go to work, you clock in and out some kind of way, right? At the end of the 2 weeks, you get paid. That's not how the medical world works. We see a patient today, we have to close out that encounter, send a claim form to the insurance company, and it could be 15, 30 days before we get paid. Meanwhile, we got to pay lights, heat, rent, supplies, and us. And so if we don't have money coming in, but we're steadily sending all of this money out, we may not be able to keep our doors open. So we can't give away free services unless that's our business model. So for example, Cook County, Stroger, whatever their name is today, you can go there without insurance, right? Some people lie and say they don't have insurance, but you could technically go there without insurance, be seen, they'll try to bill you. They may get it, they may not get the money. So every organization has some policies and procedures, and you just got to know what they are. And please, 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 those of you who work somewhere on this test, don't work somewhere. Follow what we covered, because you will be thinking, well, at my job, this is how we do it. But this test is not about what they do at your job. This is basic information they want you to know. And some of it is old school. But this is what you got to know to pass the test. And then you can just forget most of it and then just know how to do the job. So in our class, we're going to plow through all the stuff you need to know for the exam, but we are also going to really get into what's happening today in the real world, things that you need to do to carry out this task or this job, which again, anybody try to look for CMAA job description, like on Indeed or somewhere? Oh,
No, I haven't.
Okay. Well, just go on Indeed and type in Certified Medical Administrative Assistant or CMAA. You probably won't find a lot of hits, but if you type in patient registration, patient access, you're going to find more job titles. And that's because every organization gets to call a job whatever they want to call it. They don't have to call it by the title of the certification. So for example, I hold a few credentials, certifications. If I were to be looking for a job, the job title may not be my certification. It may be other words that mean the same thing. That makes sense? So we'll look at some job, we'll take a few minutes, probably next week, and look at a few job ads and see what you're learning and what the jobs are requiring so that you can start working on your resume. Because the other thing about resumes is the organizations are using computers that's scanning through your resume and it's looking for keywords. So if you say, I'm a CMAA, but that's not in their computer system for the job, that computer may not pull out your resume. So it's all about, playing around with the words for the system to say, yeah, this person should go to the next level, or no, this person should go into the trash, not into the trash, but into the, in the no pile. Make sense? All right, so that has been scheduling. Tomorrow, we are going, Mr. Pugh turned his microphone on. Tomorrow, we are going to be looking at patient intake, which is sometime before scheduling or it's after scheduling. So like at a doctor's appointment, sometimes they will do the intake over the phone, like a pre-intake, because again, we need to make sure you got insurance before we put you on the schedule. Or if you need a referral, we need to make sure that we get that referral. Okay, Mr. Pugh, I see your microphone came on.
I'm just, again, glad everybody made the first day. Ariana, just resend that. I looked through everything. I don't have it, so just resend it and I'll get it back to you today.
Okay.
Also, thank you to everybody that sent your documents in. For those of you who didn't, just try to get it in. And also just, if possible, before the end of today, try to get your technology exam turned in if you didn't get it done. If you're having an issue, just email me separately to let me know what's going on. Other than that, that's it. That's all I have.
All right. Well, I'm glad y'all turned y'all cameras on. That's good. Good, good, good. So I look forward to seeing all of you tomorrow afternoon. Everybody have a good evening.
Okay, thank
Okay,
you.
thank you.
Thank you.
Thank
See
you.
you.
Thank you.
But